Hello everyone, I'm Dr. Satya Prasad Balki, Medical Director at True Vision Eye Hospitals. There's currently a very viral post going on in social media and news articles about a particular eye drop which companies are claiming that will allay the need to wear reading glasses. This particular eye drop is called Pilocarpine. So I just wanted to give a brief about this particular trend. When we need to understand about how this medicine works on the eyes, first you have to understand the physiology of your eyes. So basically, eyes, like any other camera, when there is excessive light falling on your eye, a structure called iris, which is like a curtain, it kind of constricts and regulates the amount of light entering your eye. The same iris will dilate and lets more light enter your eye in nighttime conditions. So generally, if you see any animal photographs taken during the night time, their eyes are very bright, or they reflect the typical cat eye phenomenon which you call. So this is because the pupil is dilated and more light is entering the eye, so that you get more vision. So this is the physiology of the iris, the pupil reaction, whatever you call it. So what this drop pilocarpine does is it constricts the pupil. It constricts the pupil, and basically this drop is used in other medical conditions also, especially glaucoma, some types of glaucoma, that is. So what happens is, when pilocarpine constricts the pupil, less light enters the eye and gives you a more pinhole effect, a more sharper vision. When this medicine is used for, let's say, to reduce the usage of reading glasses, we have to understand that, first of all, when you instill this eye drop, it takes about 15 minutes for it to act, and the action lasts only for about 4 to 8 hours. In this, what happens is, after 4 to 8 hours, the effect weans off. So let's say you need to read something after this particular time, you have to instill the drops again and again. So obviously it is a medicine, you have to think about the long term effects of continuously using these medicines, any kind of medicine. Here what happens is, when you use this eye drop for a longer time, the iris musculature, which is always in the constricting mode, it starts to lose the tone of the muscle. And when really dilation is required, be it when you have when you're night driving, especially when your your pupil needs to dilate to give you a better vision, this hampers your night driving and your night vision also. And for any reason, when you have to undergo any kind of eye surgery, be it a cataract or a retina surgery, the pupil will not dilate when your doctor administers the dilation drops. It will not respond to those drops. Another thing that happens is you might get near vision with these drops, but your distant vision, there is a good chance it will be compromised because of myopic shift. So when you use pilocarpine drops, they cause a myopic shift. That means the eye refraction goes into myopia. So your distant vision might also be compromised. Another thing is, for some people who have lenticular opacities, that is cataract present in a particular area of the lens, and you use this drop, even then you will have blurring of vision, especially your distant vision. It also accelerates the formation of cataract. Pilocarpine, when used over a long period of time, it accelerates the uh, induction of cataract also. Another point here to be noted is, pilocarpine, because of Indian eyes, which are highly pigmented, it might not really show its effect on the Indian population. This also has to be adjudged, or this will take some time. More studies are required here. Another thing you might consider is, in this scenario, if you keep using it for a long time, it also causes angle closure glaucoma. This is another type of glaucoma which might be caused due to formation of posterior synechia, because your pupil is always constricted. It might start sticking onto the lens below it and increase the pressure, thereby causing glaucoma. So I would currently advise, I am caution, before using this drop, go for a thorough eye examination, and then let your doctor be the better judge here if this is required for you or not. Otherwise, just using your simple prescription glasses is always a preferable choice. That at least that is what I would advise my patients. For any other queries, we are always available here. You can always contact us at True Vision Eye Hospitals and get your eyes checked.